Welcome to the American Academy of Grief Counseling's Videogram on revealing bad news, death, or terminal illness diagnosis. And this short video will help individuals in the healthcare field and the pastoral setting understand how to better articulate and deliver those horrible events that precede an individual's death in regards to a terminal diagnosis. So many times that initial discussion that a healthcare physician has with the patient or the family, especially if a family member has passed and they have to go out and reveal that death, there are ways to do it. And unfortunately, many healthcare professionals, especially physicians, they completely and totally dread the entirety of that type of process of communicating such bad news. And nobody wants to do it. But from a healthcare perspective, it is essential that individuals not only have proficiency in regards to delivering medical care in a good way, but also have an ability to communicate the diagnosis, to communicate a death of a loved one in an empathetic and caring way. And usually it should be the physician, but if it's not the physician, at least those underneath the physician, the nurses or the LPNs as well, or those within the unit of nurse education, they are able to better be prepared to encounter this type of grief and to deliver this type of news itself. In the past, many times, death itself was seen as a failure. The diagnosis of a terminal illness was seen as a failure. Viewing patients was seen as pass fail, success or failure in regards to if one lived or died. So it wasn't so much about treating the wholeness of the person and helping the person have quality of what is remaining within one's life, but it was a complete failure in the eyes of the medical field if they weren't able to save someone. So the fear of going out and telling someone was sometimes tossed up into the air as a 50-50 chance that they would. But things have totally changed in healthcare, and the need, again, to better articulate terminal illness, to be able to communicate with the bereaved when sudden death occurs, is very important, especially for ER nurses, oncology nurses, and other areas where bad news is very, very common in itself. Of course, patients deserve better. They deserve to be treated with dignity and respect. Families of those patients deserve the same respect. But for many, these types of diagnoses, these types of diseases that occur are delivered to the patient or the family in a very sterile, uncaring fashion. There's lack of empathy, lack of discussion and education because it's such a uncomfortable topic for the medical professional, him or herself. So there needs to be a proper setting to discuss this, and also a place where the individual can release their emotions instead of being restrained in the ER room, frantically screaming and crying, and then being shunned for that type of behavior. Healthcare professionals have to realize that when someone is going through major surgery or they're waiting on a very intense diagnosis with terminal implications, that they're already in a very high state of anxiety. Now, Elizabeth Kubler-Ross, she worked in this area of terminal ill. Now, a lot of individuals mistakenly associated with the 5 stages of grieving, which are kind of applicable, but primarily they deal with when bad news is delivered to a patient or when death is revealed to a loved one about their family member. So what Kubler-Ross highlighted was the initial responses of denial, anger, complete sadness, bargaining, and then finally acceptance. Now, this wasn't maybe all in one night, but over a period of time. It's natural to deny bad news, to believe that it happened or that it occurred. It's natural to become angry. It's natural to go into a massive amount of emotion, of sadness, to express that. And then later, the bargaining comes in when reason sets in, where individuals start saying, well, maybe I can get this, maybe I can get that. And then, of course, the finality of acceptance, of realizing that if it's terminal diagnosis, this is going to happen regardless. So it's important that nurse educators, nurses themselves, even if they're not in nurse education, are able to communicate the diagnosis in an empathetic way, but also in a very informative way, so that patients are also able, or family members as well, are able to share the bad news with others in a better way, because within that own family hierarchy, there's also a way of how to express from one to the other, because there's different roles within all families. The other issue is, after the initial bad news, the continued feelings that patients have that the doctor really doesn't want to talk to them as much, or that there is an awkward type of interaction between the two, because maybe the doctor isn't trained, or the physician isn't trained well enough to handle these types of emotions from a psychological standpoint. They are not trained in grief counseling. They're not trained in pastoral thanatology. So naturally, there's uncomfort as they proceed forward, and maybe how they dictate what death is. Maybe they'll use different words for death because they're uncomfortable saying that particular word, which can also cause issues for the patient. So when it comes to communicating bad news itself, whoever is giving this this hard job to do within the facility, proper training is essential. Healthcare professionals need this training in death and dying. Not only that, not just communication, but also in just the very nature of what death and dying is, and the natural reactions that individuals have to loss itself, and what to expect from bereaved individuals. And there needs to be an advanced preparation of the professional also regarding the facts. So a nurse educator is going to have a very deep and profound understanding of the diagnosis, and they are trained in how to communicate these facts. And these facts should be communicated in a quiet and private place, not in the middle of the ER waiting room or a sterile area, but a place where individuals can sit down and discuss the issue itself. And that's why communication has to be articulate and clear, but it also needs to be reflective and emotional to the needs of the individual. It needs to be responsive, because there are going to be emotional outbursts. There is going to be a moment of crisis. And if someone is not trained to handle this type of emotional outburst, it can be very uncomfortable for them, and the entire situation can spiral out of control. In addition, the physician or the nurse practitioner or the nurse educator, whomever is delivering the bad news, should have some training in religion and death, and have some ideas about religious beliefs and a sensitivity to these different cultures and deaths, and how a family is reacting from a religious and spiritual perspective. One of the other issues that is extremely important is to give the individual time. You have just given them news regarding their own mortality or the death of someone that meant the world to them. And this is forever going to alter this individual's life. So healthcare professionals need to be willing to give the time to answer all and every question, and with honesty, and with no false promises, but with honesty and empathy, and a willingness to sit down and just take the time, and not to be necessarily even a healthcare provider in this case, but just a fellow human being. If it's a terminal diagnosis, later, maybe even, there's going to be more questions about various steps to going forward, directives to take, options to look at. And again, this needs to be done with a sensitivity, but not also an awkwardness where you're afraid to say certain things, but you're able to say them in such a professional way that it conveys the message, but it also is very sensitive to the emotional state of the patient or the family. So there are numerous benefits and training in this type of deliverance of news. Primarily those who train in pastoral thanatology or grief counseling already have a leg up on individuals. And this helps them and aids these professionals in the emotional and psychological delivery of a terminal diagnosis, and also a preparation for the reactions to that grief and loss. And it helps professionals, healthcare professionals, treat the full human person. It improves bedside manner. And in many studies, malpractices, sometimes frivolous ones especially, occur because the patient felt slighted. They felt that they were treated not as a human being, but just as another number to visit. So when there is good bedside manner and there's compassion, well, there is a reduced possibility of unneeded malpractice lawsuits. It also allows the patient or family to better process the loss in a less traumatic fashion. And that is one of the big keys to deliver and not hurt as much. Now, you're not going to be able to fix anything, but at least you can deliver it in a sensitive way where the deliverance itself doesn't have to be more traumatic than it already is. So healthcare facilities are beginning to understand the importance of conveying this information so that families have a better understanding of the diagnosis, the reason of death, or also are able to receive the news in a more sympathetic and serene, less sterile environment. So as this becomes a more pressing issue, a more important issue in our modern era, we are going to see more and more healthcare professionals and facilities training individuals to better be able to deliver this type of news to terminal patients or to families who've just lost a loved one. So 3 of the programs that I've been referencing throughout this video are grief counseling, nurse patient educator, and also pastoral thanatology. So this reaches many fields that deal with this within ministry, pastoral care, and nursing itself. So please review these 3 programs. We have the links below, as well as our office at AIHCP. Our phone is 330-652-7776, and our email is info@aihcp.org. So I'd like to thank you for listening, review the programs, and have a good day.